Currently, there are three vaccine makers that have applications in front of Health Canada for COVID-19 vaccines. And the news so far has been, I think experts would agree, exceptionally good. What we're seeing, at least from the first two candidates that have released large scale clinical trial results, we're seeing over 90% effectiveness, basically 95% effectiveness. So that means if you scale that up, 19 out of 20 people are getting protected by the vaccine if those numbers hold up. These COVID-19 vaccines are now being put before regulators. In Canada, it's under a process that's called a rolling submission. In order to speed up the process, basically it means that Health Canada and other regulators are getting the data as they come in and studying the data as they're coming in, as opposed to waiting for it in a big stack. So that's going to speed up the process. The vaccines, at least the Moderna and Pfizer vaccines, will be made outside of Canada and will have to be shipped to Canada. And also, conversations are currently underway between the federal government and the provinces and territories about how those vaccines will be portioned out. Because even though Canada has made agreements to purchase enough vaccine doses for everyone in the country, in fact, many more than enough for everyone in the country, just to kind of hedge our bets with different vaccines. Despite that, they won't all be ready at the same time, and you won't have the total number of doses that are required for the country all at once. So it may be that there'll be, a portion of the country could be vaccinated as early as the first part of 2021. Sort of even before the end of March, possibly. But it's likely that those vaccines would go to people that have been identified as priority groups. And you can think of those groups as being people who are at high risk of severe cases or of death. People who are frontline workers or who may work with people who are at high risk. So you can think of people working in long-term care facilities and so on. And then other essential workers that are needed to keep the economy going and that are potentially exposed to the virus in their daily work. Communities that are far from health services or health facilities, where it would be more devastating to have an outbreak in communities like that than those that maybe are a little bit closer to full healthcare services. So those are some of the groups that are kind of under discussion. Of course, the hope is that it won't be too much longer before you have kind of a general vaccination where anyone who wants the vaccines could get access to them. And that could be happening as early as the summer of 2021. It's likely that the more people get the vaccine, the better chance we'll have at controlling the pandemic. Exactly how many will need to be vaccinated to bring down the levels to kind of manage the pandemic is a little bit unclear because it depends on how effective the vaccine is. There's another factor here, which is something we just don't yet know, which is whether the vaccines are effective at stopping transmission of the disease or whether they're just effective at protecting people from the symptoms of the disease. So that's something that we're only going to see with more time and more data. And then the other question beyond that also is how long the vaccines will work. Of course, there are people, naturally would have some safety concerns, especially when vaccines are being discussed or being offered that are kind of a new technology that really haven't been tried before. I think this is where communication by public health agencies is going to be crucial, is for people to understand that even though the process of developing and approving these vaccines have been accelerated, greatly accelerated, Health Canada and other regulators are trying to make clear that that doesn't mean they're lowering the bar for approval. So in other words, they're making it possible to get the data and to look at the data as fast as possible to see if these vaccines should be approved, but they're not lowering their standards. They still have to demonstrate safety, efficacy, so that it's clear that the benefits of having this vaccine would outweigh the risks, and as it would for any other vaccine that's been approved.